Hey everyone, I'm Connie Hale. I'm a family nurse practitioner that runs a nurse-led cardiology clinic here at MLK Health Center. This is February. It is Heart Awareness Month, and I was asked if I would speak to you all just a few minutes about heart disease in women. I was given a few questions, and I hope to answer all of these and hopefully empower you to take better care of your health. The first thing I want you to know about heart disease in women is that heart disease is the #1 killer of women in the United States. Many of us are frightened of things such as breast cancer. Certainly, that's worth being frightened over, but the truth is heart disease is the #1 killer. And so as many of us do self-breast exams and take care of women-specific issues such as that, we need to be taking care of our heart health as well. One question that I was asked is, who needs to be screened? Anyone over age 40 needs to be screened regularly for cardiac disease. If you are a diabetic, if you have high blood pressure, if you have high cholesterol, you definitely need to be screened for heart disease. Another thing that you've got to consider is your family history. Very, very significant in heart disease, as it is other illnesses. If you have a family history of heart disease, you need to be very open with your healthcare provider about that. A few things to watch for: if your father or your brother had heart disease before age 55, that puts you at a much increased risk. If your mother or your sister developed heart disease before age 65, that also puts you at a much increased risk. So anyone with those that fits into those categories definitely needs to have a cardiac evaluation regularly, be screened. The next question says, when I go see my healthcare provider, what should I expect from a cardiac assessment? Well, that's a great question. The first thing that you need to expect is just a real conversation with your healthcare provider. Be sure that you tell them if you have a significant family history of heart disease. Also, if you have any of the risk factors that I mentioned just a few moments ago, they certainly need to be aware of that as well. You'll want to talk to your provider about risk factors that you have, such as smoking. Depression and mental stress is also a risk factor in women. In fact, women who have depression and are under a lot of mental stress, they are affected more than men in this area as it relates to heart disease. Also, smoking. Women who smoke are more apt to develop heart disease than men who smoke. Inactivity or not getting enough exercise is definitely a risk factor. Excessive use of alcohol, also a risk factor. So talk to your physician or your nurse practitioner about these things so that they are better able to help you. You will also expect to have your blood sugar tested, your blood pressure taken, and your cholesterol tested to see if it's high. Your physician might prescribe medications for these. If so, be sure that you understand what the medications are, how to take them, and why they're important to take. You also want to ask your nurse practitioner or physician about your cardiac risk. There are several assessment tools out there that healthcare providers can use to determine if you're more at risk than other women your age for heart disease. So talk to your providers about that, definitely. So another question, and this is one of my favorite questions. What are symptoms of heart disease in women? Well, I'm glad you asked, because symptoms of heart disease in women are very different from symptoms of heart disease in men. We all know about the crushing elephant on our chest, that type of chest pain, but in women, heart disease often has more subtle symptoms. It's very important to know your body as a woman and understand when something just is not right. Some things that we see are shortness of breath for no real reason. Definitely a red flag, and you need to alert your provider to this. Heavy perspiration for no real reason. Exhaustion. As women, we take care of everyone before we take care of ourselves. It's classically what we do. We often feel exhausted. What we've got to realize, though, is that this exhaustion is not always expected or explained by doing all that we do. We need to be very cognizant of that and know when something's not quite right. We feel a little different exhaustion. We need to bring that to our health provider's attention. If you have frequent heartburn, if you have sharp shooting pains through your neck or your back, or if you have sharp shooting pains that wake you up at night, shortness of breath that wakes you up at night, definitely red flags. You need to bring this to the attention of your nurse practitioner or your physician as soon as you see them. I would say make an appointment to see them for these types of symptoms. If you have a rapid heart rate, you're not quite sure why you have a rapid heart rate, you can't relate it to exercise or activities that you've just done, that's a red flag. You need to watch that. Arm pain for no real reason, elbow pain for no real reason can be symptoms in women of heart disease. Jaw pain also, that may be known by most people, that if you have pain in your jaw, that could be cardiac related, but pain in your arms for no real reason, or even your elbow. One of the things that I've seen the most in my practice as I've taken care of patients with cardiac disease are women who present with nausea and vomiting, cold sweats and shortness of breath. Those are the things that I've seen most. Most of these women will try to explain away these symptoms by saying, it must have been what I ate last night. It just didn't agree with me. And then after I got sick, I felt so much better, so I'm not really worried about anything. Sometimes that isn't in fact true. It was what you had last night, but oftentimes that is a big red flag. You need to be very aware of that. I often ask my female patients, did anyone else eat that? Did they get sick? Did they have the same feeling? And usually that answer is, no, they really did okay with it. It was just me. So you really have got to be in tune with yourself. Know all of the subtleties of your body. You know you better than anyone else. So I want to close this session up with just letting you know it's very important to see your healthcare provider regularly. Get that cardiac assessment if you're over 40 or you have any of these risk factors. Definitely need to take care of yourself. Know your risk factor. If you have an increased risk factor, work on changing those reasons. Things we can't change, family history, but things we can change. Smoking, obesity, lack of exercise, and focus on you for a little while. Do whatever you need to do to make you healthier. I want to thank you for spending a few minutes listening to this. I hope that you've learned something. I hope that you feel empowered to know what's going on with your body. We're all in this together, so take care of you.